Everyone. Welcome to today's training session. My name is Amy Hackett. I use she, her pronouns. I work in the Office of Undergraduate Education. And today we're going to dive in to boundaries and letting go with a few of our colleagues in CSE and also CFANS. We will be talking about working with students who are experiencing distress or mental health concerns and how advising and student services staff can set boundaries and let go. So at today's session, we will have discussion, opportunities for reflection and sharing experiences and resources, all related to setting boundaries and letting go. You can expect interactive elements today, such as the use of breakout rooms, where you will have opportunities to discuss your experiences when working with students experiencing distress or mental health concerns. Before we begin, I'd also like to acknowledge that as a visitor on this land, I have a responsibility to acknowledge the grounds on which we gather in the pursuit of higher education. We acknowledge that the University of Minnesota Twin Cities is located on Dakota traditional, ancestral, and contemporary homeland in the land now known as Minnesota. As a community of learning, we are committed to honestly examining the facts of American history, especially regarding the injustices Euro-American communities perpetrated against Dakota, Ojibwe, Ho-Chunk, and other indigenous peoples during the settler colonization of Minnesota. We also recognize the labor upon which this educational institution, state, and country is built. We acknowledge the peoples of African ancestry who were enslaved and forcibly brought to this land and whose forced labor played a major role in the formation of this country. We are indebted to their uncompensated labor and their unwilling sacrifice over hundreds of years, which continues to impact generations today. We honor the legacy of the African diaspora and the continued contributions of their survivors. We acknowledge the contributions of all immigrant labor, forced labor, and undocumented people who contributed to and continue to contribute to the building and feeding of this land. We acknowledge their immeasurable sacrifices and work that allows us to gather in this space today. May we consciously reflect on the legacy of colonialism, genocide, and capitalism, and take meaningful action towards education, reconciliation, and truth-telling. I'd like to credit the Twin Cities German Immersion School and Canada College as sources for today's acknowledgement. As we move on to our next slide, let's talk about a few logistics for today's training session. We are recording and we plan to share afterwards. You can ask questions using the chat or the microphone. Just be sure to mute your microphone when you're not speaking. We have time set aside at the end for questions. If you have something particularly connected or critical in terms of the content in front of you, feel free to put it in the chat, but otherwise we have time saved at the end for questions. We are using Zoom software today to provide captions, which we recognize may not be 100% accurate. And in a minute, I know that having the materials accessible to you is important. I promise that I will post to the chat a link to all of today's materials so you can follow along as we move forward in today's presentation. I'd like to cover a few grounding reminders before we begin. We hope that you are able to find ways to take care today throughout today's session. We know it's a busy time and a busy day. There's a lot going on. So we encourage you to sit, stand, stretch, stim, move around. Let us know if we're talking too fast or if you have any access needs. Feel free to chat me directly with those. Just to let you know, we also do have a short break planned about midway through the presentation. So I'd like to move next to introductions. I'm so thankful to our wonderful colleagues, Rose Simon and Marnie Andrews, who are with us today for sharing their time and their talent in making this training possible. They've put in a lot of extra time and effort beyond their demanding jobs to prepare this for us today. Because it's important to them, this particular topic. And so they have some experiences and insights to share with us. So I want to welcome both of you here and thank you for your service to our community and for being willing to share your experiences. So without further ado, I will go ahead and turn things over to you. Feel free to introduce yourselves and get things started.
Thank you, Amy. Amazing. Good afternoon, everyone. I was about to say good morning. We are into 1 o'clock now. My name is Rose Simon. I use she, her pronouns. I am a social worker. I'm in the position in our CFANS advising office called the CFANS Wellness Navigator. And I'm really excited to be here with you all and grateful for Marnie.
Hey, I'm Marnie Andrews, she, her pronouns. I am also a social worker and I work as the Assistant Director of Advising and Wellness Advocacy in the College of Science and Engineering.
Okay, so before we get started, I just want to say thank you so much for taking time ahead of like in your busy days and your busy week to be joining us this afternoon. I know it's kind of a long period of time. As Amy said, we will have a bit of a break midway through. And before we scare you away with breakout rooms, the word of breakout rooms, we actually have like a mini ending first with some time for questions. And then those of you who would like to stay maybe a little bit longer to do some debriefing or like being reflective and kind of like back and forth with your colleagues on sharing ideas on how we can set boundaries, we have time at the end for some breakout rooms. So just want to like before we lose you completely on that, because I know that's not everyone's jam, and that's okay. So, all right. So really to start, when Marnie and Amy and I were having this conversation back in December, the world has shifted a lot since that point in time. So we just want to really acknowledge that our conversation today is taking place, perhaps like for you all, feeling like a very distressing, difficult time in our community and in our world. We know that our students and staff are really affected and are experiencing higher levels of distress right now. So this conversation today feels even more important than when it was in December. So our conversation today is around boundaries, but it's not going to encompass necessarily all of like the nuance that surrounds that. And our goal is to really just help us to navigate what we as humans can do to sustain and protect ourselves during these times, especially during these periods when we are oftentimes experiencing parallels to our students. So, kind of a bit of an agenda. We're first going to start with just kind of setting the scene. So, talking about student mental health statistics, what are we seeing on campus, and how is this impacting our staff? We are going to dive into a little bit about boundaries. What are they? How do they help? What are the things that are making it difficult for us to set boundaries? Along with doing some like idea sharing and tips for setting healthy boundaries. We are also going to spend time talking about like ambiguity, tolerating ambiguity and letting go, especially when we have those students that are just like, oh, they've held on to our heart and we have to help our nervous system and our body kind of move through that and process that. So we will be spending some time towards the end discussing that. Today we're not necessarily focusing on like specific resources to send to folks. We do have a great list of like resources that we've put kind of in the material folders on like that Amy's going to share out. So if you're looking for materials, that will be available to you. And today's not necessarily about how to have those very specific conversations with students. This is more about a reflection on our own boundaries, working to maybe recommit or create boundaries that help you sustain in your important work. So yes, let's do that. Framing our conversation today. Today's discussion is focused on interpersonal and intrapersonal factors that affect our boundaries. We acknowledge that there are systemic factors that play a big role here. We won't necessarily be diving into all of that today. Again, today is more about like, how do you survive and thrive in a system that is under stress, that is changing, and that may not be structured in a way that encourages our boundaries all the time. So, and can really exasperate us. We want to note that there are some like, while we have some suggestions, this is not prescriptive. There are no like one size fits all. And so this is really like you are the experts in your life. This is really you about reflecting on your boundaries, what you're hoping to get out of this. And it does involve maybe some trial and error. Maybe we try something that doesn't work, we try something else. That's okay. It's never too late to set new boundaries. Okay, last few points here are just kind of outlining our expectations for one another during our training. We really want to be able to show up, grow as a community, grow as a collective. This space is meant to be supportive. It's meant to be respectful. We're not here judging on other people's progress and where they're at with their boundaries. Our focus is on ourselves. That being said, we encourage you to really like focus on your own stories when sharing out. If you do feel like it's important for you to share on like a student story or something like that, we do ask that you remain anonymous, keep that confidentiality when it involves another person. And as a reminder, today we are not necessarily talking about students in active crisis. So how we respond kind of in this session or for a student who's in active crisis, this is a little bit different. So know that that's kind of not our focus on today. So, all right. Setting the scene. So you all probably have seen these statistics. This is from our U of M specific like health survey, our college student health survey. This was from 2024. But I really wanted to like frame again, if you haven't seen these statistics in a little bit or haven't seen the updated ones in 2024, these are some of the statistics that we're seeing on campus with our students. So 50% of our students are aged 18 to 24, report being diagnosed with a mental health condition at some point in their life. We have 26 to 27% of 18 to 24-year-olds who report a diagnosis in the past year. We have 60% of 18 to 24-year-olds who reported mental health issues negatively affected their academic performance, so their grades, their focus, their attendance, workload management, things like that. And nearly 46% of students report not managing their stress well or in a healthy manner. Students who reported a particular issue, they highlighted that the greatest impact on their academic performance were disability, so 72.7%, mental health issues at 59.6%, sleep difficulties at almost 60%, and stress at almost 55%. So our students are really being impacted right now. We know that like environmental factors can really impact those health outcomes as well. And we know that college is a really big stress factor for students and can really like exacerbate those mental health concerns. So if in addition to all of that, of like just that transition to college, they also have personal stressors, they have maybe some adverse childhood experiences, they're navigating relational concerns or outside school dynamics, world events, community events that are impactful, all of that can really exacerbate how our students are able to show up and be a student. And oftentimes, right, like as advisors, you are the first line of contact for those students experiencing that distress. And that's really huge. And that can be really, really difficult. I do want to just take a moment to pause here. There wasn't really a great place to necessarily like slit this in, but really wanted to identify when we say like students experiencing distress, what does that mean? What is distress versus crisis? A crisis is that like acute or sudden change that causes coping mechanisms to fail and puts maybe an individual at immediate risk of safety. Versus distress is like maybe an individual is overwhelmed and struggling, but they're generally able to function, though maybe like at a reduced capacity and it really doesn't feel good for them, right? So just wanted to like clarify crisis versus distress. And today we're really focusing on those students who are presenting to us, maybe in distress. What else? Okay. Yeah. So today, goal, focus on creating those and holding those healthy boundaries when we have those students that are walking through our door feeling really distressed by their environment or struggling with their mental health, or both, because let's be real, they're oftentimes stacked when they walk into our door. So what does that oftentimes look like for staff? What does that look like for you all? Really wanted to start this conversation by saying like, why is it important to hold boundaries with our students? And again, you being kind of that front lines for students experiencing distressing circumstances, it's hard and it impacts our well-being, certainly. So, sorry, I'm getting used to the system that I have set up here where my notes are like in a weird place. We know that like compassion fatigue, right? When we have people that coming into our door, it can really exacerbate how we're feeling. That exposure to other people's suffering can accelerate our burnout. It can impact our levels of stress and our personal and mental well-being. And like when you all as educators and as staff members in helping roles, you all are constantly showing up emotionally to support our students. And it's really common for those people in those types of roles to experiencing something called compassion fatigue. I'm assuming a lot of people might have heard that, but maybe don't know how that necessarily presents itself. I think it can sometimes be hard to reflect on and figure out, like, am I experiencing that? Is that something that's true for me? Oftentimes it shows up as like Are caring feelings and acts of compassion declining? So sometimes that's replaced with that like impassiveness and that detachedness. Maybe you've noticed in your advising meetings, you become a little bit more task oriented and less like emotion focused. So why are you here? Let's talk just about classes. I don't really want to open that door of how are you? How are things going? No, really tell me, right? Like we go more into task oriented. And I'm going to also preface and say that like 30 minutes, oftentimes we do have to be task oriented. So there's a little bit of acknowledgement to that as well. Physical and emotional exhaustion. I don't know about you, but some days I go home and I lay on my couch and my dog is like, why haven't we walked yet? An hour and a half later, because I cannot stand up because I'm so exhausted. So oftentimes that's how that's showing up for me. I also notice sometimes I get a little annoyed. I get a little anger in there, maybe my intolerance down, I'm irritable, I'm skeptical, cynicism. Those are all things that show up maybe very subtly in our compassion fatigue, but it's hard to keep caring. And sometimes we lose that like patience for those things. We get a little bit more short with students. We get a little bit more, they should know better. I'm certainly, that happens to me too. And I have to take a moment to pause and reflect on that and take a moment to take breath and remind myself that maybe that's a good little cue that I need to be doing better at taking care of myself so that I can better show up and be compassionate for my students. So what essentially are boundaries? I mean, I think that this is a question that a lot of us ask. We talk about boundaries and we don't actually know, like, we get the general sense of what boundaries are. But I think it can be hard to figure out, like, what does that sound like? What does that look like in our conversations? They are essentially what I like to call like an invisible line that defines what behaviors are acceptable for an individual. Sometimes those are internal boundaries or like a boundary that I've set for myself that I hold myself accountable to. And sometimes they're external boundaries. So a boundary that maybe is set with other people that's verbalized. Like maybe with a supervisor, we're setting an external boundary of this is the time that I leave work, right? And that's a known boundary. They can be physical in nature, emotional, based on time and space, things like that. I'm a firm believer that boundaries are a form of self-care. I think they create clear guidelines and limits to what you want and what you need. And when we are working with a lot of students who have various and complex needs, I think we think of boundaries as potentially being like cold or limiting our relationship with that student and with others, but actually it's a strategy to like ensure that we are taking care of ourselves first so we can show up with more compassion in our work. It's that very like typical, like put on your own oxygen mask before helping others, right? So I think we can maintain enough emotional and physical energy, or like our boundaries help us ensure that we can maintain enough emotional and physical energy to engage with other aspects of life. So for me, that means I have energy to maintain my relationships with families and friends. It means that I can contribute in the communities that I'm a part of. And it just like ensures that I'm taking care of my own mental health. So I just think that this is an important time to, as we're here today, being present and thinking about like, even if you do have boundaries set up, I think it's important to continue to ask yourself, what are like maybe boundaries that I can commit to that are new, or perhaps I'm recommitting to boundaries. Like I've definitely talked about having that boundary in the past, or I've wanted to, and I sort of vaguely put some lines there, but maybe we're recommitting today to some of those boundaries. I really want to be able to, you all to walk away from today and feel like you have an idea of what those boundaries look like, so you can continue to be present in your work, in the communities that you care about, and really still be able to hold on to your compassion, but without it overcoming you. So why are boundaries so difficult to set and uphold? And I'll let Marnie kind of dive into the details here, but I just want to say first, like we know that I think oftentimes you all are probably coming to this saying like, I know I need to set boundaries because I can feel myself getting exhausted and overworked and busy and the work just doesn't stop ever. Like our work is a constant demand for our energy. And that can really like accelerate to our burnout. And so we know that we need those boundaries. But like even knowing that, it can be really, really difficult to set those boundaries. So we really wanted to like highlight what are some of those boundaries, and why are they so difficult to set and uphold.
Thanks. Yeah, so it was interesting because I was just at an event right before this and was talking with somebody, and we were just talking about advising and how it's hard work, but it's also hard work. And I just like that really resonated with me because we don't get into this work because we are looking to make a lot of money necessarily. We do it because we care about people. And so in order to set boundaries, we have to understand what is triggering us to violate them to begin with, right? And so I want to talk a little bit shifting gears here and talk about internal challenges that may make it difficult for us to set and maintain those boundaries. So these are the things that are happening inside of us. And they're typically things we have a little bit more control over and can work on improving. And so as we talk about these, I want to invite you to take note of anything that's really resonating with you, because those may be indications of stuff you want to dig into later today or even beyond. And so some examples would be starting with this idea of fear-based drivers. And so think of this like a fear of disappointing your students, or fear of being seen as uncaring, fear of conflict. Maybe there's a fear of being reported or complained about because you're not doing enough. And when fear is the driving factor, it can create this shortage of what we would call positive emotions. Maybe you don't feel accepted. You don't feel like you're doing enough. You don't feel appreciated. You don't feel respected, things like that. And it can also mean that we begin to experience too many emotions that impact us negatively, which then can manifest like some of the things that Rose was talking about. So anxiety, anger, resentment, helplessness. I mean, I can speak for myself and say that like when I'm feeling really burned out, it's not uncommon for me to feel sort of indifferent towards my students. And I'm not proud of that, but that is usually an indicator to me that like I'm not holding my boundaries. Another example of one of those internal pieces is this idea of sort of a fixer mindset or a hero complex. So feelings of wanting to like save or fix the situation. And when you really boil down the why for that one, often it's due to just really a difficulty with tolerating student discomfort. We don't like to see students in distress. And so we feel this urgency to relieve that distress. And so then at times we'll take on more than we should. It can also present as sort of an over-identification. Rose alluded to this earlier, but often we have shared experiences with our students. And so it's normal to have those shared identities, either identities or shared experiences that you can see yourself in that. But if we're not careful with that, we can miss things because we're identifying too closely. Along that same vein, there's something called countertransference. And we talk about this a lot in the world of social work and counseling, but this can happen when a student's situation triggers our own emotions or our own emotional reaction. Because our inner needs, or maybe like we identify with a trauma that they experienced. And if that happens, we may find ourselves caught up in a situation or find it really hard to separate our emotions from the student's emotions. So like what's mine to hold and what is yours. Another example is this idea of perfectionism, this belief that like we should just be able to handle it all, right? Sometimes we experience difficulties with boundaries when we tie our self-worth or our self-esteem to our perceived job performance. And that can make it really hard or difficult to maintain the emotional boundaries, especially when somebody is experiencing distress or mental health challenges. In those instances, we may feel tempted to overextend ourselves emotionally beyond what is appropriate for your role. And similarly, sometimes that guilt pushes us to overwork, overextend, overgive, even at the expense of our own well-being. And that's when we get into those situations where we don't have anything left in the tank for our personal lives. Something really similar, and this has come up in a variety of different settings, but just an idea of lack of clarity or direction professionally. I think most of us here that have worked in advising for any period of time know that advisors can often be expected to be the catch-all. So if X happens, go talk to your advisor. And feeling like setting a boundary in those situations sometimes can feel like we're failing. That lack of clarity of role in particular can make it difficult to figure out who's responsible, right? What am I supposed to be doing? And do we, when we are working with a student, what kinds of things need to be handled with a referral versus what is my responsibility? What is in the scope of my role? And so when we lack that clarity in that sense, it can make it really hard to know, am I doing my job? Is this someone else's job? Am I being negligent? Am I doing enough? Things like that. Another thing is this idea of a scarcity mindset. So this can look like a lack of trust or knowledge in resources around campus. That idea of like, if I don't do it, no one will. We know that the university is a really big place. And so when we refer a student to a resource, we might worry that they're not going to get the care that they need. And again, it could be really tempting in those situations to overextend ourselves beyond our role. And so when there is a limited trust in that sort of institutional follow through, that can manifest as sort of a hyper responsibility. Another really straightforward one is just this idea of emotional avoidance. So saying yes to avoid uncomfortable conversations, avoiding that boundary setting because it feels awkward. I won't get into too much, but like the compassion fatigue and the burnout, that just reduces our ability to tolerate ambiguity. It can increase our irritability or our rigidity around things. And it really just depletes our bucket. And then this was a new one when we were kind of talking through this, but this idea of identity and socialization. So it's really especially relevant to helping professions. But when you think about, are there gendered expectations around caregiving? And I would consider advising caregiving. There is a sort of a cultural norm around self-sacrifice. So how many of us have heard the lines of like, education is a noble profession and, the pay is not really why you're in it. That doesn't negate all of the other pieces of you can work in this profession and still have boundaries. And so lastly, just know it's hard to maintain boundaries in a professional sense when you're struggling to do this in your personal life. And also if you're not consistently maintaining boundaries, because it is an ongoing active practice that we have to engage in. When we talk about external boundaries, I'm not gonna dive too far into these, but just acknowledging that like there are definitely factors that are within our control and that those pieces that are happening within us, but there's also those things that are happening around us that we maybe don't have as much control over that impact our ability to set and maintain boundaries with students. And so, environmental and societal stressors, everything that we've experienced as a community in Minneapolis lately. And I think maybe Rose is going to dig into this a little more, but just this idea that like when those things are happening, how does it change the fluidity of our boundaries? Institutional messaging, and this is one that I like, anybody that's worked with me knows I've talked about, but that whole student first idea without the structural support in place, that promised rapport that the institution talks about with students when they're coming in, of you're going to have a designated advisor, and they're going to be, everything you need. Technology and accessibility norms, those flooded inboxes that we all navigate, that demand for availability, instant communication expectations, things like that, calendar creep. And then again, like that ambiguous role expectation. So I think we probably all have experienced a little bit of scope creep, right? That idea of like, this was the parameters, but now I'm being asked to do a little bit more or a little bit more. And it kind of starts to blur the lines of, where does my role stop and somebody else's start? Another one that I just want to throw in here is just this lack of clear escalation pathways. And being reactive versus proactive. And I'll probably say this again later, but today is a great day to have that conversation with your office. If you haven't talked about what does an escalation protocol look like, to start setting those boundaries as a team and as an office. And so in short term, when we talk about like, what is the impact on students when we struggle or we are unable to hold clear and healthy boundaries? In that short term, the student is going to feel very supported, right? They're going to experience immediate relief. They're going to feel very connected to you. They're going to feel like they're getting what they need. But in the long term, likely it's going to look like they're going to struggle to engage with other campus resources because they've only worked with you. Maybe they don't understand the real role of an advisor in their experience, or they're relying on one person instead of an entire network. Which means that we're not letting people do the work that they know how to do. They may have fewer opportunities to build coping skills. And they equate care with this idea of like unfettered access to you. Um, Maybe they don't learn how to navigate a system independently. And those implications don't stop when they graduate. There are potential implications when we don't set boundaries for how they may engage in a professional setting. So think about, if they had total access to their advisor, I can email you at 10 o'clock at night and you're going to respond. They may then go into the professional field and have that same expectation of a coworker. And hopefully that's not going to be well received. And so at the end of the day, when we don't set boundaries, it means that students don't actually get the support that they need. We live in this world of instant communication and, like Rose said, high acuity. And so those blurred boundaries can unintentionally reinforce that expectation that support is immediate and it's individualized rather than a skill that we have to develop and networking that we have to examine and work through. And so I heard this analogy a long time ago, but basically it was just the idea that boundaries are not a barrier to connection. They are a bridge that help us get safely from one area of connection to another. And so if you were crossing a river, you'd likely prefer to do so with a bridge so that you could do it safely. And not having that bridge, or in this case, that boundary, risks you getting swept away and the student getting swept away and hurt. And that's true for us as professionals, but also for our students. And so there is a ripple effect when we do not intentionally set and maintain boundaries, both with our students and with our colleagues.
We're running a little bit early, which I am here for because last time we were very far behind. So I'm glad that we're a little bit early here. So we're gonna take a little bit of a 5-minute break and reflection, or we can start with reflection and then because we're a little bit early and we're not quite to like halfway through the presentation. So what I might suggest, if it's okay with you all, and Marnie, you can, I'm just like going rogue here, because we're like quite early to this point. I'm kind of wondering if we take a few minutes to reflect on these questions and I open the Mentimeter and then we chat about, and then we actually take like a true 5-minute break so that people can actually not have to work on their break. Is that okay with folks? Fab. Okay. So Marnie and I were talking about wanting to kind of really be thoughtful in some of these questions for you all as we kind of start to engage in the second half of our presentation, which is really talking about like, okay, now what? So we know boundaries are good. We know why we need boundaries. We are just kind of wanting to explore next how. Like, what does that sound like? What does that feel like? Where do we go from here? So we wanted you to take a moment to reflect on what are your boundaries right now? Kind of reflect on, do you want to recommit to any boundaries that you've worked on before that you're feeling like I've been loose on these and I really want to like firm up those walls again? Are there any that you want to expand on or build new ones? Do you understand where you need or want boundaries? Do you feel like you have what you need to make those boundaries a reality? So I would love for you all to take maybe just 5 minutes, if you have a pen and paper, jot a couple things down, be thoughtful about this, and then we'll pop up the Mentimeter here soon. And that question that we have here at the bottom is, how might your work look and feel different if you were consistently upholding your boundaries? So think about those boundaries up above and those questions of like, where are they at right now? Where do I want to recommit? What happens when those are in place? How does that look and feel different if you were upholding those? What do you think would change? How would you know? So take maybe 5 minutes, reflect on those boundaries, and then we will come back maybe at like 1:40. Yeah, let's do it. If folks are wanting to jump right into answering the Mentimeter, you're more than welcome to, and we'll just pop it up maybe at 5 minutes and give a couple extra time for people to respond, and then we'll look at them together. But I see some responses already coming in, and you're more than welcome to do that. I'm going to start transitioning into pulling up the Mentimeter here, and I will put the question into the chat. And let me go ahead and unshare and reshare. Am I still screen sharing? No, hold on. Can you see the Mentimeter?
Yes, I can. Well, I see your slides, Rose.
Oh, okay. Hold on. I think I have to pause. I have to share this one. How about now?
Yes.
Amazing. I don't know why that made me feel really cool that I could do that. Okay. These are some spectacular answers, y'all. And I really appreciate the thoughtfulness that went into all of these. I can tell you all were really thinking about it. So thank you. Thank you for participating in that. There are so many good responses here. I don't even necessarily know where to hone in on, but I want to just take a moment, pause, read some of these. I'm seeing a lot of like physical symptoms that people would find maybe more energy. They would feel less fatigued, less irritable, less stress, calmer, less frustration, less anxiety. Yeah. More energy at home. I saw this a couple different places. People who are saying like I want to be able to come home and like have time for my family. Yeah. This response is really, really valid. This one, like feeling like my boundaries, I know what my boundaries should be and want to be, but still feeling like how can the university support me in doing that? And that can be tough. That can be really tough. I oftentimes try and remind myself of like, what do I have control over? What can I control and change? And even then, that can be really hard. But sometimes those are a lot of those internal boundaries of like, I know what my boundaries are and I am going to set them, and do my best to communicate when I can. But totally valid that that is a really difficult thing to navigate. Yeah. Less anxiety. I'm exhausted by the emotional labor of teaching faculty and other instructors that it's okay for them to uphold boundaries with students. Yes, I know. We need this training for them too. Everyone deserves to have boundaries. And we are going to touch on that a little bit because I think that's a super, super fair point. We get into this, we'll talk about it soon, but that kind of comparison piece of so-and-so over here is not setting boundaries, and that's an unrealistic expectation then put onto us when we're trying to uphold our own boundaries. Yeah. Not feeling drained at the end of the day. Wouldn't be thinking about it after work. Yeah. Less apathy, more patience. Yeah. Well, these are great, y'all. Thank you so much. Oh, I love this one. Like when I stick to my plan, it frees up space in my day-to-day to breathe. I can focus and give one project or a student or a task attention, which is great. Instead of feeling all jumbled all around. Yeah. Oh, I love this, y'all. Yeah. Love this. Feel comfortable taking time off for mental health needs. Absolutely. Yep. Yes, I love this. You can bring a horse to water, but you can't force it to drink. To teach a man to fish and he'll eat a lifetime. I love that. More appreciation, more relaxed, lighter load mentally. Absolutely. Calmer and more confident. Yes. Yeah. I think when we have strong boundaries, I do feel more confident myself because I know what I need, I know what I want, and I'm setting it, and I'm setting a good example for those around me. And like really feeling firm in that, despite maybe it comparing to other people. Yeah, it can feel really, really good when we feel firm in those. Thank you all so much for sharing this. Is there anyone that like wants to share? It's okay if you don't. Is there anyone who is looking at these and feeling inspired or wants to share a little bit more about what they wrote? Either in the chat or out loud? It's okay if not. How about we take some time to really like, as we're thinking about boundaries, I kind of love this. I kind of love that it worked out. I'm going to stop my screen share. There we go. I love that it worked out so that we can actually take a real pause and a real break instead of multitasking, because I think that that's a good boundary. So why don't we go ahead and take the next like 5 minutes to go to the bathroom, grab some tea, stretch out your body, and join us back around 2 o'clock, or not 2 o'clock, around. Well, you know, we've got a little bit of time. Let's give ourselves like a 10-minute break and come back at 1:55. How does that? We'll do, let me share my screen here. I gotta give you credit, Amy. It is hard to multitask. This is not always easy. Hold on.
If I can help with anything, Rose, let me know.
No, thank you so much. I appreciate it. I like kept being like, can you see my notes? What's like in the way? Was it like cutting off for people too? Was it a little blurry?
That was good.
It was good? Okay.
Yeah.
Because sometimes it looks a little funny on my end, and I just want to make sure. Okay, let me scooch this over here, and then I'm going to do this. Enter full screen. And then I'm going to share. There we go.
I was say, Rose, while you're getting it all pulled up. So we were just kind of chatting, and I think thinking on our own experiences when it comes to setting boundaries. And I know that for me, over time, I've seen sort of this shift in how I connect with students. I think early on, I was noticing some of those like physical symptoms of how I was showing up. And I was able to identify that I was feeling a lot of internal pressure to help students because of my own experiences and identities navigating higher education. And so, in hindsight, what was really happening for me was that I was trying to fix things for students because I was a first gen student and there was no one to help me, and all of the things that kind of go along with those identities. And so, in the process of fixing, I was taking away a lot of opportunities for them to capitalize on their own resiliency. And so, I had to start reflecting and doing some really hard, like mirror work is what we would call it, and realized that that was a boundary that I wanted to work on. And in order to do that, I needed to start asking my students different questions. And so instead of, you know, how can I help you? I had to hold space for them to find the solutions on their own. And so a tangible example of this would be a student shares the problem, and instead of telling the student, here's the resource, this is what you need to do, asking them, has this happened before? How did you manage that in the past? And asking myself, when I overextend myself for a student, what are they not getting the opportunity to practice? Or, like what skill is a student missing building if I remove any uncertainty from this situation for them? And that has caused me to slow down. And I think for me, I often find when I am violating my boundaries, it's because I am too in the moment of like, I've got 1,000 things to do today. I need to get you in and out to the point of like, it's very transactional. And I have to slow down because I am not doing myself a service and I am not doing my students, I'm doing them a disservice when I don't slow down. I also find that my students, I think, notice when I am present with them in that moment of whatever's happening. And there's a lot of joy. And I think then we saw that reflected in some of the comments of like when they figure that out and they lean into that resiliency of like, oh, I am getting that kickback of like, this feels good because it feels good to hold the boundary, but it also feels good to see students start leaning into that resiliency and autonomy. And so I don't know if Rose, if you want to add to any of that, but
yeah. Oh, it's beautifully said, Marnie. And it makes me think a lot about like as I was getting into this work, I think I felt like I had to like fill this giant void of need for students. And I was coming home really excited about my work, but really exhausted. And to be honest, I still have days where, actually most days, where I come home and I'm so tired. And I know I mentioned that earlier, but like my fatigue and my exhaustion is really real. So I don't want to like stand up here and pretend that I'm sitting on a pedestal and I know what boundaries are and I do them perfectly. I actually really struggle with them. And what's interesting is that sometimes it's almost like I've boundaried so hard sometimes that I'm like doing all the like self-care stuff and like I have therapy and I have all my doctor's appointments and I like go for my walks. And honestly, now I've overdone it where I'm still exhausted because I'm adding too much to my day. Like I'm overdoing it. So I'm still exhausted. And it shows up in a lot of different ways. I will find that like, when I'm meeting with students and let's say I've had like this oftentimes happens on my drop-in days where it's like, okay, I have 2 planned scheduled meetings in the morning with students and then I get like 3 during drop-ins. And I just feel really like I'm not present because I'm like trying to get things done. I'm kind of like, why do you need sometimes my students come to drop-ins and they just want to check in. They just want to say hi. And I'm like, why are you here? Like, there has to be a point. And I noticed that like intolerance for like feeling frustrated or irritable and whatnot. And I just like have to step back because it has a really big impact on my students who are there to build relationship, who are there to be heard. And when I am not present, they know. They know when my brain and my heart is just like distracted and elsewhere. And so I don't know, I'm still playing this like balancing act, and it's definitely not perfect. But I guess to kind of go back to your point, Marnie, of like, I'm really trying to remember that like, one, I can't be everything for students. We have to like build this collective, we have to encourage students to have multiple people in their lives, similar to like, I'm sure there's like some parents in the room we really want our little people, our little kids to know that they have multiple trusting adults in their life to rely on, that it's not just mom and dad. We want them, when it's appropriate, to have like positive relationships with their teachers, with their peers, with other family members, right? We want to be able to know that they know how to build like good rapport with other people and not just rely on mom and dad. And that's kind of what I have to remind myself in this setting of like, we want to encourage students that it's like not just us, that there are other people, and that they inherently have their own set of tools in their toolbox. Like that these students, given the opportunity, have like already gone through so much in their life. They have a lot of tools that they know, and they're inherently resilient to all of it. And so oftentimes they will find a solution on their own. So those days where I feel like I'm leaving my work, like, and I still feel like I have like, oh, I didn't respond. I need to get back to data and I need to do this. And they're not, what if I have to send this mass email, otherwise I'm never going to find that thing. And it's like, okay, these students are really resilient. They really are able and capable of doing their own research, of reaching out to someone, of asking for help when they need it, right? So really putting it back on, I have to trust our students to like ask for help, do their own research. They have their own tools. They're inherently resourceful, right? So I kind of have to reframe that again of like, it's not on me. I need to not lean into that hero complex, and remember that my students are inherently resourceful. So, okay, that was a long-winded answer. Thank you for bearing with me. We thought we'd share a little bit. You all shared like such thoughtful responses, and we wanted to share a little bit more from our perspectives as well. So I think you all kind of answered this. As we were doing that Mentimeter, you all were kind of naming, like, how do I know if I need to work on my boundaries, by identifying like what it would feel like if we had boundaries in place. So perhaps we would feel less exhausted. Perhaps we would feel like we can show up and be present with our family at the end of the day. So on the opposite spectrum of that, like, what does it look like when we don't have those things, when I need to work on my boundaries, right? It means that I'm exhausted when I come home. It means that I'm feeling really stressed and anxious, and I'm still having those processing thoughts after work about my student. It means that I'm really neglecting my self-care or my hobbies or my favorite activities, right? So I think you all are very aware of like, how do we know? What are we looking for? How do we identify? But specifically wanted to look at like how else this might look. So giving some other broad examples, but knowing you all are very aware oftentimes of how this looks and feels. So what might it like look like physically, perhaps for advisors? How are we seeing it? Loss of sleep. I think a lot of people have difficulty sleeping, racing thoughts. I'm just like chronically ill all the time, it feels like. In fact, yesterday I had a sore throat and I was like, uh-oh, that's a sign. That's a sign I need to take care of myself and take a day and slow down, because I know that I'm starting to get sick. And that is a sign. Digestive problems like stomach aches can really manifest like that physical. Anxiety, panic attacks. Oftentimes we're preoccupied or just thinking constantly about the student and their problems or the trauma that they shared with you, that really, really heartbreaking story that they shared. It like really sits with us, and we are constantly thinking about it and thinking about them, hoping everything turned out okay. And we can't like let go of it when we leave work. It's still just like present in our mind. Feeling overworked, feeling burnt out. So just feeling like, this is crazy, and just feels like there's no end in sight. I work in a hospital at another job, and honestly, if I didn't actually say I need to go home, I could literally nonstop work for the entire week overnight. There would never be an end, because it's a constant rotation and cycle of things. And that like overwhelm of like, I could just keep going. It eventually leads to that feeling like so overwhelmed, so overworked, so burnt out. And I think in this work as well, we can totally identify with, you leave office and it's not like you have this checklist that was just like done, 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 done. We leave the office and we carry like what we have to think about and do tomorrow. We have to be worrying about tomorrow's problems. So I think that can lead us to feel really overworked and burnt out. We start like ignoring and neglecting our self-care, as you all had named, that like compassion fatigue, those kind of signs and symptoms of compassion fatigue or secondary traumatic stress. Um, Sometimes it might look like, oh, I'm doing something maybe I shouldn't do for a student, like I'm overcompensating in my boundary and I know I shouldn't be doing this, but I am doing it for this specific student. Like this is like a really extreme example, but like I picked up a student and drove them home from something. Like they couldn't get home, I drove them home. And then all of a sudden, we're noticing maybe that we're feeling kind of secretive about it or feeling ashamed and you didn't want to tell your coworkers or your supervisor. Like maybe that's a bit of a sign that that was a boundary that was crossed and that was maybe not an appropriate boundary. I also added this one in here, that overconsumption of social media, that numbing and overwhelm. I don't know about you all, but when I get home, man, I am just scrolling and that like inferno of like information and news and events and like things that happen during the day. I totally numb out and I'm so overwhelmed by it. And I just notice that like at the end of the day when I'm exhausted, I just kind of like doom scroll all the time. And it doesn't do a lot for me. So I don't know if anyone else relates to that, but that is a very real one. How else like might it feel or sound or look like for advisors? That kind of like wondering if I don't do it, who will? And that goes back, I think Marnie was saying this earlier. That goes back to Marnie's point of when we work in a system that's really large and oftentimes where there's like systemic issues that create barriers that we don't necessarily trust, it can be really hard to send a student off into the void to reach out to a resource without knowing that it's going to be helpful, that they're going to get connected, that it'll be a positive experience for that student. And so oftentimes it feels like we have to take that on and say like, I will make sure that they get there, or I will overcompensate and I will do the thing that the student needs. Similar vein, like believing you're the only one who understands or could help the student. This is a big one, feeling like you care more about the student's problem than they do. Like you're constantly worrying about it and the student's like, it's whatever. Like, students who are like on vacation when they should have been here for a test and you're like, oh, you really should have been here. Like I'm stressed for you. Like, how are you going to do this? Have you thought about this? And they're like, whatever, like feeling like you care more. And you're putting in a lot more energy than where the student's putting in energy. Feeling pressure to always say yes to helping, even in situations outside of your wheelhouse. Feeling pressure from the student, feeling pressure from the system that we're in, feeling pressure from supervisors or leadership. Sometimes there are a lot of things where we have that blurred role boundary, like what is within our role and not within our role. What's within our scope and our wheelhouse and what's not. And that can be really easy to start to like I think you called it something creep, Marnie, right? Like boundary creep of like, but if you
creep,
just
boundary creep. Yep.
Yeah, if you just do this little thing more, like that's good. Or make sure you're checking on this, and it's starting to feel like it's creeping out of your wheelhouse. Just something to be in tune with. Believing that your ability to fix the student situation is directly connected to your worth or ability as an advisor. That is so difficult, right? Like we want to feel like we are really good at our jobs. And sometimes it feels like we want that satisfying end. So we're going to fix something. We want that like bow tied situation is fixed. And we feel good about it. We feel good about like, we have that immediate gratification of like, yes, we did good. I did good today. I fixed the student situation. We're all good. And going back to Marnie's point of like, it's ultimately not as helpful for the student, right? When we ultimately come in and try and fix it for the student. We want to really help them build those resiliency, that problem solving, that initiation from students. And similarly, last vein, taking charge to solve a student's issue because you believe they are not able or capable of handling it. So we're taking away the student's autonomy. And that's also not helpful for students. But sometimes that's what it can kind of feel like, of like, oh, I have to solve this, or I have to fix this, or I have to do this. I'm feeling pressure to do this. So those are just some other ways that we oftentimes see it.
I was watching the chats that were coming in and I'm like loving all of it. And there was one specifically about phone calls. And I think we all probably have experienced like students often have like a real, I'm going to say like a genuine fear of making phone calls. And so I loved this idea of like, coaching them through it, right? Like knowing that, yeah, you could pick up the phone. Another example of that, when I've had a student that's just like really hesitant and I'm not going to make the phone call for them, is sometimes I'll just sit in the space with them and like let them do the talking, and sort of having someone there almost has helped foster some of that, like, okay, I got this. And like, then the training wheels can kind of come off. So then the next time. And so I love this, all of the examples that were in the chat, but that one was like really resonated with me. And so there was a question that came in when we were doing the RSVPs about, how do I navigate this when there's maybe a misalignment of personal boundaries or like professional expectations and things like that? And I jokingly was like, it's like the boundary Olympics, right? Like who has the best or worst boundaries? And so I think we can't talk about boundaries without talking about the ethics behind them. And it can feel like when we are comparing boundaries that we're comparing our humanity or our willingness to care about our students. And we have to remember that ethics are not about who does the most. Ethics are about what produced the least harm. And so the example was specifically about like faculty and staff. And so if and when a faculty and staff, really anyone, has what you would perceive as an unhealthy boundary or just like that red flag, right? We have to approach that with curiosity and asking yourself, is this setting individuals up for realistic expectations? Managing expectations does not mean that we are withholding support. It just means that we are holding space for folks to do for themselves. And so I think of it similarly to, this idea of like reasonable accommodations, right? Just because we want it and just because we ask for it does not mean that it is reasonable. And so as educators, we do have a very sometimes difficult privilege of helping our students and sometimes our colleagues reconcile this. We know in higher education, there's power dynamics in almost any interaction, and it can be really difficult to speak up in those circumstances. And so approaching things with curiosity can really help in those moments. I don't know if we have any Ted Lasso fans in here, but I'm always like, be curious, not judgmental. And so instead of, when, let's say somebody comes and says like, well, I'm going to do X, instead of saying like, this is a bad idea, something like, I can see you're trying to do good, right? Acknowledging the intention. I wonder how this might impact that individual as they interact with other parts of the university and the expectations that they have. Because there is a lot of value in letting the experts do their work, right? Like we know what we know. Our colleagues in this office know what they know. And that's part of why we work in collaboration with each other. Ethics and boundaries mean that we can't just, again, look at the how can we help, but we have to look at how are we potentially causing harm when we don't hold and set boundaries. And so that, it again applies to how we engage with our colleagues who may have those urgent requests that overstep our boundaries. So, Rose brought up when we were talking about all this, a colleague reaches out with an urgent matter, right? They have a student request, they need a quick turnaround, but you have that boundary, for example, that you leave work at 4:30 and you've already had a busy week. Holding that boundary can feel hard because it can look like or feel like we don't care, but we have to hold firm in that and give ourselves permission to say, I am not my best when I don't. And so there's a lot of power in shifting from this idea of how can I help to how can I contribute within the scope of my role while still honoring my boundaries and the boundaries of my students and colleagues. Because we as advisors are not meant to be the fixers. It is not our job to always fix the situation, help the situation, but we can almost always contribute to making the situation better. And when we ask and reframe that question, it changes how we might show up in a space. And so we want to talk a little bit about some skills and strategies, examples of how this might play out. Some of these are going to be a little more proactive, but they're hopefully things you can put into practice that'll help you before a situation like this arises. And so one phrase, we mentioned it earlier, is this idea of putting on your own oxygen mask first before assisting others, right? And this is in reference to attending to our own needs before we help others. That might sound really selfish initially, but if you think about it, you can't really be the most effective or helpful to someone who needs your support if you aren't supporting yourself first. And so that can look like, we said, therapy, vacation, exercise, whatever fills your cup. Similarly, a really good proactive approach is just being intentional about taking time to reflect and understand yourself, understanding what may come up as a trigger for you. So I mentioned that example earlier of like, I was feeling like I wasn't a good advisor, when really what that was about was I was uncomfortable and I was tying my worth to my work. And that can be a really tricky thing to navigate. And so looking at and using some strategies to try and maintain those boundaries, doing that reflection work. You can also learn to recognize those red flag indicators like we talked about, and actually practice, some of the mindfulness and grounding techniques that we're going to talk about. One thing that I use really frequently when I'm just like, I always say like my shoulders are holding up my ears. I'll say to myself like, this is a breath in and this is a breath out. And that gives me just enough time to kind of ground myself and reprioritize what's happening in the moment. Another really proactive strategy involves setting expectations in those communications with students. And so explaining to them your role and what you do very clearly and what you don't do as well. And this can be true with our colleagues or other individuals who may not be familiar with our work. Talking and orienting them to, other campus resources so that they are building up their own little resource bank and their safety net for when they actually need it. And so sometimes I feel like a lot of internal pressure to be the resource. But for your student, that is a lot of pressure for you. And it's a lot of pressure for your student too, to say like, you're the only person I can go to. And if I can't get an answer from you, then what am I going to do? And so we have to give ourselves permission to say, I'm not the person or the resource, but I can connect you to the person that is, or the resource that you need. Something I've come back to a lot over the years is just that there is no other relationship in my life where I am expected to be the end all be all for that individual or meet all of their needs. I don't do it for my partner. I don't do it for my children. I don't do it for my friends. And so I cannot put that kind of pressure on myself at work either, because I am setting myself up to feel like I am failing. And so reminding myself in those moments where I'm feeling like I have to be the fixer of like, I cannot be the end all be all here. I am not that important, right? And then the last two are just about building up your knowledge base. It is really reassuring to students when they are coming to you in distress if you are confident about the type of resources and referrals that you're sending them to. They're also more likely to follow your suggestions if you're knowledgeable and familiar with the help that you're giving out there. So bonus points if you can give them an idea of what to expect. So an example of this, we had a number of individuals in our office who had never been to Boynton. And so I said, hey, would it be helpful for us to just walk over there and talk through, and we were specifically talking about students in crisis, but to just like walk over and talk through what happens if you have a student in your office that needs to go to same-day counseling. We got together as a group, we walked over, we went up the stairs, we went into the office, we talked to the front desk, they showed us where the students should sit. They gave us an idea of like, you can now leave based on this information. And that's great because then you're not trying to figure that out in the moment when you need the resource. So walk over to Boynton, find the Aurora Center, talk to a DRC consultant. These things are going to make you feel more comfortable when those situations come up or when you're trying to talk about those referrals. And it'll also probably make you feel more confident in saying like, this is my boundary. I am not the person for this, but I know the person that is, and here's how they're going to help you. And I mentioned this earlier about the crisis escalation piece, but like we all want to feel like we know what to do in those moments. And so if your office doesn't have one, today's a great day to have that conversation. Tomorrow's also good, but I would encourage you to think about proactively, how am I going to be prepared to hold a boundary when it comes up? Where am I noticing some discomfort? And then what do I need to do now to prevent that in the future? Some other just like more tangible examples of like what does a boundary look like? So we've talked about calendars, and as I've taken on more responsibility, one of the things I found for me is like I have to block my time, right? If I don't put time on my calendar to work on specific projects, it's easy for me to fill that. And so thinking about like, are you spacing out your appointments to give yourself recovery time? It's just as important as meeting with students, because if you're going back to back to back to back, are you able to show up as your best self in those appointments, or are you finding you're slipping into more of that like transactional and interaction? Sometimes we know flexibility or an open calendar is not always a good thing. That's what I was finding for myself, and so that's why I've gone to that project blocking, and then building that routine that works for you. Email, we talked about this a little bit, but just, are you setting a precedent for communication? What is that? So are you responding to emails at 10 o'clock at night? I will say that we all know that work happens after hours, but I, for example, have found on those nights that schedule send is my best friend, so that I am not setting a reasonable expectation for my students, but I'm also not creating an unreasonable expectation for my colleagues. I don't want to put them in a position where they're now interacting with a student and they say, well, Marnie emailed me back at 10:30. And so thinking about like, what are your boundaries around email? Same thing with like committees and initiatives. Sometimes we're already feeling really stretched thin. And so knowing that we sometimes have to take a step back, and that doesn't have to be forever. Sometimes it is situational based on what is happening in the moment or in that period of time in our lives. And so being thoughtful about how you are expending your energy, both interpersonally, but like in a bigger perception or bigger perspective related to those other duties as assigned, right? And then just communication, remembering your scope of practice, and then not setting that precedent that indicates that you're able to discuss, distressing things or crises, to no end, right? So trying to move away from that, like, we can talk about anything you want to talk about today, right? We've all done it, because that sets the tone for the appointment. And so really empowering those students to seek assistance elsewhere for mental health issues, but also helping them understand the parameters, again, of what the relationship should and can look like.
Can I add a couple things, Marnie, that I was
Please,
thinking
yeah.
about as you were talking? I was just thinking of, we have some fantastic colleagues in my advising office in CFANS who are really intentional on their email responses. Sometimes they'll include like an automated response that kind of outlines expectations for timeline and getting back to students, which I think is just such a great tangible example of how we can like tell and notify our students of expectation of like, this is a really busy time of year. It's like, busy registration season. Please do not expect a response back within give me 48 hours and then I will respond to you, hopefully within that time frame. And that way students just know like, hey, heads up, I'm really busy and like you can't expect me to turn this around in 2 hours. And if you do, here's like drop-ins, like here's another alternative that helps you uphold not feeling like you have to respond in like such an immediate way. And it gives you like it really outlines without you having to somehow communicate that elsewise with students. So, and another thing I will just like, something that I was reflecting on as you were kind of saying these is I'm thinking about all the times that someone will just like, pop on your calendar a 30-minute appointment, or you see an email come through and you need to respond, or a student staying a little bit extra long in their appointment time. There's just these little things that really add up to feeling overwhelming. Or you get a communication and a request for something and it feels kind of urgent. And I start to notice myself getting into kind of like frantic response, and to make things easy, I just go, yes, absolutely. That's fine. Yep. Because like coming up with how do I set this boundary right now is really difficult. And I think that's a good reason why we should have those proactive things. For example, on my website, it says like, if students are booking less than 24 hours in advance, you have to email me. Because I need a heads up. I need to plan 24 hours in advance at least. And also I give myself permission in the day if I'm noticing myself like getting overwhelmed with all those little things, all those little requests, little asks, people coming into my office, I take a second and I like pause Because I think the immediate response is yes. But if I take a second to just like, what do I actually need to set a boundary on? Like instead of just saying yes right now, take a moment. Does this align with my boundaries? Or do I need to take a second to say no? And that's okay. So I think that that's a great precedent of like reminder, slow down, take a breath, especially on those days we're feeling really frantic and saying yes to everything, and just try and recommit to those boundaries. That's all I'll say on that. I think just like chaos ensues when we don't like slow down, you know? Just thinking of those days. So, how else do boundaries sound like? So, I think we had prefaced this before. Sometimes boundaries, I think we assume sound cold or like we don't care. And that's can honestly be more than far from the truth, right? We can really make sure that when we're framing our boundaries, that we're doing so with a lot of compassion. You know, when we're working with students in a mental health distressing situation, and we know that we're not a therapist, but we really care about this student, we can reiterate that. So, you know, we can reiterate, like, I'm so grateful that you trusted me with this. I'm so glad that you're looking at like seeking support for this. And I want to make sure that you get the help that you need. And unfortunately, I'm not a therapist, but I would really love to connect you with some of my amazing colleagues at Boynton Mental Health Clinic. Are you okay if we sit together and call them together? Or can we make a plan to get access to this resource, schedule an appointment, things like that? It's again saying like, I really care about you. I want you to get the help that you need. I just can't be the one to do that necessarily. And so let me help you get connected. And what are the ways that I can, in this big system, help you make a step towards it? Like I'll sit with you while you call, or I'll sit with you while we figure out how to fill out the My Boynton portal. Like you have to fill out all the forms first before you can book an appointment. Like kind of doing those steps together to help us in this big system do that, what's within our capacity to help, right? So not the fixing, it's the like, how can I contribute? Thank you so much for trusting with your story. This is so much for you to carry. Let's talk about what you will do or who we will contact to like get you support if it's after hours, if it's like over the weekend or after my work hours. And kind of like a reaffirm of here's what's available to you. Sometimes I'll have students put in the Boynton crisis line in their phone so that they have it. So they're not emailing me again, hoping for a response. I'm taking that proactive step to make sure that they have that resource, that they're not relying on me for that resource. Yeah, all those things. Obviously, we talked about this earlier, we preface this, like these are not necessarily crisis conversations. That looks a little bit different. We do have the red folder in our resource page or resource folder after the presentation today. And the mental health advocates training is a great resource if you're looking on conversation or language on how to navigate those student crisis situations. So just as a just a preface. We would love to do this. We did this in a presentation 2 years ago, and I think this is really helpful for folks. You all have a ton of experience in your work. We know that you all have great expertise, great ideas. And so we would love to hear from you on what do your boundaries sound like in your conversations. And last time we shared a whole like sheet of all those little like conversation pointers, and it was so helpful. I know other people have used them in like their advising units or other trainings. It's just really good to get like a collection of here's some ideas on how you can approach hard topics and hard boundaries. So I would love to take just a few minutes here to you all to think about what is a boundary that you have and how do you communicate that with empathy, with compassion to our students or with fellow colleagues. I'm going to add that in there. If you have a way that you want to share, that you communicate your boundaries with your supervisor, with staff, with colleagues, with faculty, feel free to add that in there. Let's take, let's take just a few minutes here. These can be nice and short, and then we'll look at them together. Let me know if anyone has issues getting access to it.
Hey Rose, I think I tried to copy the link into the chat and I think I got the wrong one. So apologies to everyone
Let
because
me
the former Mentimeter link came up. Marty or Rose, do either of you have
hold that one.
the one for this prompt? Thank you, Rose.
Let me see. Do I have to start the presentation? Does that help?
Yes, you got it. Yes,
Okay.
that one works.
Okay.
Okay. So everyone use use the link that Rose just put in the chat. Thank
I'm
you.
sorry. Hopefully
No,
the
you're
QR code's still accurate. That should be the right one.
okay. Yeah, I probably put it in too early.
Yeah, I didn't start the presentation yet.
There were definitely tidbits from the last time we did this that I have taken and used because I think sometimes the hardest part is you know what the boundary is you want to set, but you don't know how to say it. And so I think learning from each other is such a like gift to have so many people in this space that have great language of what it sounded like to set a boundary. And so again, I think Amy will likely we will compile this and it will be sent out in some way, shape, or form for you all as well.
Mhm. I'll give it another few seconds here in case you need the QR code. Otherwise, the link is in the chat, but I'm going to start sharing the Mentimeter responses as they come in. Can you all see that okay? Great. Thank you.
I love the one about the well-being notice. That is mwah.
Oh, that's really sweet. Yeah. Oh, I love this same day example. That's great. Can you guys see them when I highlight them? Like run my, okay, great. So you know which ones I'm talking about. Love this one. Very practical. I love it. That's great for with our supervisors, with our work in general, not just with students. Love that quote. I want you to experience the best version of me and my work. Taking on any new tasks or projects won't produce that. Absolutely. Claps. Love that.
Another one I've seen sometimes come up related to that is that scope creep of like being asked to do more. And along those lines of, the power dynamics of I'm happy to do that. However, what can I then, take off of my plate? I only have so many hours in the week. And so in order to accomplish that, there I'm going to have to not do something. So what would be your preference or what are your priorities, especially when we're talking with somebody that maybe is in a higher position than we are?
And I think that helps. Sometimes I think about like, sometimes when we start overdoing too much in our work, it becomes the expectation. And a reminder, you can always set a new boundary going forward. We can always change our mind just because we were doing 150% and we were doing half of someone else's job and we're doing a dang good job at it, but it's impacting us personally. You can still set a new precedent and a new boundary and say, yep, this isn't sustainable for me. I don't need to continue to do this. So help me prioritize what you would like me to be doing in my work. Start a clarifying role in orientation. Absolutely. Yeah. And then keep little reminders here and there as you go. Absolutely. Yeah. Fake sound. Let's take a pause. Yep. If we're derailing a little bit. Yeah. I always say that of like, oh, we're over here. We're like maybe building some rapport. That's fine. But then I'm like, I really want to make sure that we address what you came here to address today. And so would you mind if we recenter ourselves and talk about what you came here to talk about? And like do a little like, oh, I love that we had that conversation, but like want to respect both of our times and come back to the reason that you're here. Mm-hmm. Gosh, you guys, these are so great. I love that I'm not a counselor. I'm not an expert. Exactly. Yep. Mm-hmm. Yep. I will not be available. If a student asks to meet outside of my working hours, I will not be available at that time, but I'm willing to work with you within my scheduled time. Absolutely. As long as that scheduled time, I really have to be careful with this because I add in a ton of appointment spots during a week. I really have to be careful about like, I've learned from the past of like, is 4 meetings too much? For me, I have hour-long appointments and they can be really heavy and there's a lot of follow-up sometimes. So I have to really kind of gauge what am I able to add in for the day? What's a reasonable accommodation for me? Even if I have that hour technically available for a student, do I actually think I will be present during that time? And I have said no to students before. Even if I have that hour just sitting in my working times too. So, all right. These are awesome, y'all. I really, really, really value your perspective here. If you please keep adding to it, I'm going to keep us moving because we are limited on time. But please keep on adding and we will share the list that you can also continue to add to. So you all have fantastic things to say and really great experiences. So let me go back to sharing this. Sorry, y'all, this is like gymnastics over here. I have like 3 monitors. Let me see here. Yay, okay. I think we're back in business. There we go. Thank you so much for sharing that. Really, really appreciate it. It's so helpful to hear and reaffirm some of these things. All right. So what happens next? Let's say we've set the boundary, and sometimes setting that boundary means we don't always get an end. We don't always get the perfect picture. I know I had mentioned this before, like I said, I work sometimes in a hospital and sometimes I see a patient once and that's all I see. And I will think about their story for a really long time because it's like, I never knew what happened to them. I don't know what happened next. And living in that uncertainty, that ambiguity is really, really difficult. And so I know for you all, as we're working with students, we oftentimes have a student that comes in, oh my gosh, they made a meeting and we've been trying to meet with them for golly, a whole semester or 2 semesters, and you finally hear from them. They come in and they tell you everything that's been going on in their world, and it's a lot. And then you never hear from them again. And it is so heartbreaking. And it is so hard to live in that ambiguity of like, what happened to that student? Are they okay? Or yeah, we set that boundary with the student that's coming into our office, they're in distress. We refer them to Boynton and to all those resources, and then we don't get closure. We don't hear from them again. We don't know what happened. We have to live in that ambiguity. And so we really wanted to also acknowledge that sometimes that is hard in advising. That's hard in the work that we do. And it's really easy when we don't have that like closure that we start seeking it. And sometimes it overlaps our boundaries. Sometimes that goes beyond, we're putting in more effort to try and reach out to this specific student. Because we want to have that closure. And sometimes we have to set our boundaries and live in that ambiguity. And so how do we do that? It's really normal for us to like have big feelings about having to not know what happens, right? So I just want to like acknowledge that first, that it really is difficult to hear from students, hear their stories, and then not hear anything back from them. And like we really start to develop rapport and care for our students. And so it's really normal when we feel attached to our students and we want to have the best outcomes for our students. So really just like acknowledge your feelings, let yourself feel them without shame, because I think that's really important. Give yourself space to have those feelings, talk about it with a supervisor. write it in a journal, right? Like it's okay to have those feelings. That's not abnormal. Really offer yourself some self-compassion and some self-care. So, I mean, I think that's pretty self-explanatory, right? Of like, it's understandable that I feel this way. It's understandable that I'm worried about this student. I'm still worrying about this student. I'm noticing myself. I'm not going to judge myself for how I'm presenting today because that worry is sitting with me, right? And so having self-compassion for yourself in that regard. I really appreciate this like reframing the ambiguity. I know that we can't do this in every circumstance. I know sometimes this feels like it's not doable, it's not possible, or it's too what's the word I'm looking for? Like, yeah, sometimes things are too heavy to necessarily do this reframing, but I really, when I can, I try and reframe how I think about the situation. So instead of like thinking about this student who went off, came to you in distress, you tried to connect them to Boynton, and you're maybe not sure how, if they got connected, if they got the help that they need, if they're doing better, and then they just like drop off and we don't hear from them again. I think our heart and our brain immediately goes to worst case scenario, which is really scary. So instead, coming back to maybe let's reframe this. Let's think of another way that maybe it worked out. Perhaps the student is thriving. Perhaps they got into a therapy program and they need to take a break from school, but they're taking care of themselves and it's all going to be okay. And we just haven't heard from them yet, right? So like reframing to maybe it all worked out. Imagining that student, picturing that student healthy, happy, and doing well when we can. And really noticing if we're kind of in that, like, what's the word I'm looking for? Like where we over catastrophize things. That's the word I'm looking for. Give ourselves permission to disconnect. So sometimes when I'm driving home and I'm still thinking about a student and I will literally say out loud, all right, Rose, the social worker, has to like take a step back, and like Rose, the friend, the dog mom, the like person who loves her hobbies and being outside, like that person gets to come to the forefront right now, and I'm going to disconnect from my work and I'm going to completely leave it at work as much as I can. And I literally will talk myself through it while I'm in the car on the drive home. So, and for me, that is that intentional reflection time. So, but just take moments to notice and try and be really reflective and notice when you're having a hard time letting go, and make sure that we're reaching out for support where that feels helpful for you. So what if my body and my nervous system can't let go? So we can coax ourselves to do all these things, right? But it is so real that our nervous system might get impacted, right? Especially for people who maybe are like, have similar experiences as our students. Our students traumatized from something, you've had a similar trauma experience in your past, right? Like we know that these big things can impact our nervous system and can make it really hard to let go physically. We can say all the things and still it holds in our body. This can oftentimes appear as like anxiety, fatigue, that those like emotional things, irritability, anger, frustration, that numbness, just like not feeling really foggy, not feeling present, those types of things. So what can we do? I'm really into breath work and mindfulness practices. So deep breathing, whether that's during the day, whether that's after work, meditations, walking outside, focusing on your breath and your surroundings. On a similar vein, somatic regulation. So, you know, our bodies hold a lot of our stress and trauma. So this presents oftentimes as like a physical tension or like restlessness or even pain. And so somatic practices could include gentle movements, stretching our neck, standing up and stretching. It can include like shaking out our hands. It could be tapping on acupuncture points, deep pressure hugs, weighted blankets, things like that. Movement is really helpful. One that I think I forgot to put on here that I meant to is also creating predictability. So establishing routines, making tea before bed, a walk in the morning to center ourselves. This creates a sense of stability and safety. And just like a reminder that not everything is out of your control. There are things that we can control. And then I think sometimes what's helpful when we get really overwhelmed with things is this like move to action. So how can we shift from, we have mentioned this before, how can we shift from like, how can I fix this to maybe like, how can I contribute? What's a small actionable step that I can take that helps me to take back that power when we're feeling really frozen in the kind of like overwhelm of everything going on. So, and regulation and action. So again, if you're feeling really stuck, that's really normal and that's really okay. What are other ways that we can like help regulate ourselves in this work, or take those proactive steps to maintain those boundaries and feel stable and feel regulated in our work? We have these here, these like little sections here, and Marnie and I, as we were pulling this up, we're like, we really don't want people to like sit in this and say like, God, that's so tone deaf. Like, obviously, we would love to take our vacation days. Yes, we know we should talk to EAP and our supervisor. Like, we should be doing these things. And stop telling me that I need to take a vacation day. Like, I know, but like, work is always here. And I think that I really like say this with a lot of love and a lot of compassion. Because I think when we say like, you should go for a walk and you should do meditation, and people are just like, right? Like if I would have already done that. And I think as that's landing with you, reflect on how that makes you feel. Like, is it frustrating? Do you feel stuck again with like, I can't, because then work is still going to be there. That cycle will continue. And so, and there's never a good time. And so I really want to like offer that like gentle pushback of, I know we're like, feel like we can't do this and we feel frustrated and we feel like there's still going to be more work tomorrow. Try it anyways. Like that's a sign sometimes that we need to step into these, whether it feels like we can't, like in those moments where we're really overwhelmed, we have a ton of work, we don't feel like we can do this, there will never be time. So you have to make time. And we won't ever feel that like letting go until we start taking care of ourselves. And
Rose, I
so
just wanted,
a lot of love.
sorry, I just wanted to add, and part of this conversation was just this idea that there will always be more work than we can do.
Yeah.
Like it's this isn't like reading a book, right? Like you don't just get to the end of the day and like everything's done, right? Some days we have like an ability to check off things, but like I think when we can reframe our work as like there will always be more work, it gives us permission to say like I can only do what I can do, and I can only do what I can do today, and the rest of it's going to wait, and that's okay.
Mm-hmm. So take those vacation days, sign up for a fun art workshop, learn how to sew, learn a new activity, sit outside and soak in the sun when it's warm. Actually, I enjoy it in the winter, but detox from technology, have quality time with your family and friends, all those things. Do the things that fill up your cup. The world, life is too short, man. Just enjoy your life outside of work. You deserve it. And it's a really great example for our students as well. Okay, next slide. We are doing like a mini pause / closure because we know that breakout rooms are not everyone's like favorite thing ever. We saved, maybe we'll do like a few minutes of questions. And then for those of you that are like feeling like I'm energized to have these conversations about boundaries and I really want to have an open conversation with my colleagues on how can I like some idea sharing. We wanted to create space for that. So, but let's pause first. Thank you so much for listening to a spiel for 2 hours. What questions do you all have? How are you feeling? I might keep an eye on the chat here, and I will also maybe stop screen share quickly just so that if people want to unmute and chat, I can see you better.
I can share. Hi everybody, I'm Dia, or you see her pronouns, academic advisor in CLA. I don't necessarily think like my issue or like I don't have a problem with setting boundaries. I think I wish I had more control over people's expectations of me because I already do. Like, and this is kind of really more personal than work. Um, but like I overly do or show up simply because people have that expectation. So I just fall in the trap of just like, they ask you to do it because they know you're dependable. They know you're reliable. They know you'll show up. So that's kind of my struggle. And then I guess the boundary part will come, but it's just more like people they have all these expectations of me. And
Mhm.
because I don't know, but that's my thoughts during this whole thing was, I think I would get the boundary part if I could control my expectation.
Mhm.
Yeah. I mean, I really appreciate that because I think that the running joke is always like the reward for good work is more work, right? And so like asking yourself that question of like, I know I do good work and, what do I want this to look like? And then how do I communicate that? Because we know that disappointment shows up when there's a misalignment of expectations. And so figuring out how do you align your expectations of what you want this to look like with somebody else's so that everybody's clear on what they can expect, I think sometimes can make it a lot easier to like set and hold those boundaries.
Mhm.
I think too, like that for me has looked a lot like being really clear up front, like long before the actual specific boundary moment, like kind of trying to proactively use language that shapes my capacity so that if I'm like comfortably within at a baseline, like knowing that people are gonna be like, oh, can you just pick, you're great at this, can you do that? Like if I've set myself sort of a slightly more contained starting point, then I'm not very good at saying no. And so I've purposefully built enough room knowing that like ideally sometimes my boundary needs to be a no. I've also purposely given myself enough room to like be too tired to do the hard work of saying no, where I can sort of slide into saying the yes, but I have enough room that that's like a stretch of my boundary but not actually like breaking my boundary. And I think as we hit like I work on the care team and like our inbox we're hitting the busy season and our inbox was popping off at the beginning of this week, and I was like, oh good, I actually can like tolerate what is definitely an intolerable amount of a pace because I've like set my baseline to have some of that wiggle room. And if it were always this way, I would just be doing a job that wasn't sustainable. But I can like look to the low season and sort of set that as my baseline and then tolerate these stretch times because I know that there's an ebb and flow where I think sometimes we accidentally kind of keep stretching when I feel really seen and known when someone's like, you're really good at this, can you do this? And next thing I know, I have a 110% job and I'm still getting more asks, and then I'm doing a 150% job and I'm wondering why I'm always burnt out. And so I think learning that if I start from a baseline of like not totally at capacity, then I often am at capacity, but like with the add-on asks, and it feels good to be able to say yes when somebody asks. But it took the like pre-boundaries work of managing expectations up front to like help me better be able to like say the yes in the moment.
Mhm. Mhm. Absolutely. Such good perspective. And it's good. That reminds me, Dia, of like it's really hard. So I was just chatting, looking at the chat, saw your name pop in there. I when you are such a dependable like team member, you setting like that boundary of, hey, this is my capacity. Like I do better work. If you think I'm dependable now and like do really good work, I'm gonna do even better work when I have like more of a laned focus here. And I'm willing to be a team player and like add in some things in here, but like the expectation remains that this is my baseline and this is what I have capacity for. And it helps your supervisors and other people in your office go, like, who else can we build dependency on in our office? And not just constantly come back to Dia because she's so fantastic. It helps us to make sure that we're investing in all of our team and creating opportunities for all of our team members to show up and be such a great team player. So it's a benefit not only for you, but also for your team. Mm-hmm.
This makes me think a little bit too about, and I want to be mindful of time because I know we were like, oh, we have so much time right now. We are. But like, there's also a lot of power in having like an accountability buddy almost of like those colleagues that you feel closeness with and that you feel comfortable challenging to say like, here's my boundary, right? Like, and if you see me pushing past this, like call me on it, right? And so an example I'll give, I had a colleague who very similar, like said yes to like everything. And then that was coming at the expense of like they were showing up late to personal stuff and things like that. And so I like very directly was like, hey, I'm curious. You told me this was something that was important to you. It seems like you're having difficulty maintaining that. And it was enough of like oh yeah. And we had to have that conversation a few times and they did the same for me. And so thinking too about as you're setting boundaries, are there people close to you that see the work that you're doing and can help you stay accountable once you've set those boundaries is huge.
Are there like questions or thoughts that are popping into people's head here as we're kind of nearing our end?
Well, I don't have any issue with setting up boundary, whether with my advising colleague or anything. I don't have anything. Just one advice usually kind of ran into more like managing student expectation, and especially first year student. Yes, when you decided to come here, this is Big Ten University. This is a city by itself. And I'm sure that you have come to this campus a few times before you decided to come over here. Of course, see like Site 101, Sociology 101, Microeconomics, it's going to be like theater. But it's in fact, because it's a public university and the first year and second year classes, that's something you cannot avoid. It's really hard to get personalized attention from your instructor. If you study hard, do your homework, reading chapter before coming to classes, you're going to be okay. No, yeah, tuition is more affordable, but first year, second year classes is like theater. It's a fact. It's a fact of life. And, and CLA is not fit for everyone. That's something that you really need to make thoughtful decision before you came here. But when you get into third year, fourth year classes, yeah, it's going to be much smaller. But, as long as you survive the end of your second year, yeah, you're going to be able to succeed. And, I mean, I have few students that, especially first year. This is like so big, like few hundred students inside 1001. Yes, it's a fact. Because the public university is much more affordable. That's why you have so many students. Versus, if you go to St. Thomas, it can cost you quite fortune too. It's like that, that's something you have to make thoughtful decision before coming here, right? So, and it's usually like managing student expectation
Yeah.
to get here.
Yeah. And what they expect from you as their advisor, as a faculty member, as a staff member, and how you're interacting with them. Yeah, absolutely. Thank you for sharing, Christopher. Amazing. Well, thank you so much for being here. I know we only have 3 minutes left. I'm like, what do we do now? Can I get like a raise of hands of how many people would like to like spend some time with colleagues reflecting on their own boundaries? I'm willing to stay a little bit after 3 o'clock to help coordinate that, but I recognize not everyone has that time.
It's really informative and really helpful. Just want to say thank you so much.
Absolutely. Thanks, Christopher.
Thank you. Okay, bye-bye.
Amazing.